Kristen, can we have agenda? Yeah.
Yes.
Good morning, Mr. Chairman.
Good morning. Good morning and welcome to everyone to our audit committee meeting, and the agenda is being displayed here. Thank you for those of you that are present. First item on our agenda is to review the minutes from our June 12th meeting that were sent to us in this meeting packet. Are there any questions or comments about the meeting minutes from the June 12th meeting? If not, then we'll call on Joe Hood for comments from the department this morning.
Thank you, Mr. Chairman. I appreciate everyone's attendance here on behalf of the department. Welcome. We're happy to have you here for our audit committee meeting. I do apologize, it's a little bit out of sequence. We typically have not had an additional audit meeting at this point in time in the year, but we have a number of internal and external audits that have been ongoing that we felt the need to provide an update and to provide awareness on. And then we still have our financial audit from last year to review. And we're going to do that at a subsequent meeting, given the volume of items that we have to cover today. But we really appreciate you being here and your attention to this. And we're going to have subject matter experts present on different aspects of the audits that we have, but the status of our current and completed audits, our financial audit update for a particular schedule that relates to employer schedules for state health benefit, and then some performance audit updates, particularly related to Health Facility Regulation Division. So welcome and thank you so much. And with that, I'll turn it back over to you, Mr. Chairman, to start our meeting.
Okay. Thank you, Joe. And I think we're ready to have David Chong start our presentation. Thank you, David.
Thank you. Good morning, Audit Committee Chairman Cruz and DCH Board Chairman Folsom, Audit Committee members, and Commissioner Burke, and other DCH executives and colleagues. I am David Chong, Deputy Inspector General for the Department of Community Health. It is always a pleasure to provide an update on the status of active and completed federal and state audits. Joining me today are Inspector General Sonia Ellen Smith and our audit team member, Kristen Raleigh, Auditor 3, and HFRD Healthcare Facility Regulation Division Executive Director, Lisa Davis. Our agenda for today's committee meeting will highlight 3 specific areas. The status of current and completed federal audits through CMS, GAO, and the same for the state audits through Department of Audits and Accounts, DOAA. We'll also review the GASB 75 OPEB employer schedules, which are financial audits. Lastly, Lisa Davis will present the personal care home program performance audit. We currently have 3 active audits with our federal partners, 2 active audits with the CMS, and 1 active audit with GAO. The first one is Home and Community-Based Service, or HCBS, Service Assessment. As part of CMS' ongoing effort to provide states with technical assistance regarding HCBS setting regulations, CMS conducted on-site visits to assess implementation of these criteria throughout the Georgia program. DCH continues to meet with the CMS on a regular basis to discuss the status of approved milestones to ensure DCH will be 100% compliant with the settings rules. This impacts the 4 waiver programs, including EDWP, which stands for Elderly and Disabled Waiver Program, ICWP, Independent Care Waiver Program, now New Option Waiver Program, and COMP, which is Comprehensive Support Waiver Program. The next one is Medicaid Managed Care Plan Program Integrity Audits. CMS is conducting an audit of the program integrity activities of the Georgia Managed Care Plans. This audit reviews the managed care plans compliance efforts with utilization of cost avoidance effort and whether the plans have proper safeguards in place to prevent improper payments. Additionally, this audit reviews claims in areas known to be high risk for fraud, and it also includes a review to determine if services were medically necessary and that the services were being delivered. It also includes a review of denied claims to determine if the services were medically necessary and were not being inappropriately denied by the plans. The last federal audit is enhanced data matching could help prevent duplicate benefits and yield substantial savings. GAO has conducted an audit to identify CHIP beneficiaries that have duplicate CHIP coverage in selected states, including Georgia, and also identify individuals receiving advanced premium tax credit, which is APTC benefits that have duplicate health insurance benefits from Medicaid or CHIP in selected states, including Georgia, and also assess CMS and selected states design and CMS monitoring process to identify and prevent duplicate health insurance benefits in multiple states. Currently, GAO has provided a draft copy of the report for our review, and our management has reviewed and responded back to GAO. Okay. Next, we'll go over the.
I'm sorry, David.
Go ahead.
I just wanted to mention, make sure that it's clear that, so we are still awaiting the finalization of those audits. That's why we're not going through them in detail as far as the review, because we're waiting to see the final result from them to be brought back to us, is my understanding.
Yes. Mm-hmm.
Thank
you. Okay. Last week, while preparing for this committee meeting, we had 3 active states audits, which are performed by DOAA. Today, one of the 3 audits has been completed, and an audit report was released last week, and including a copy given to board members. The first one, this audit, which was completed last week, is Medicaid Dental Program, which was a follow-up performance audit from 2021. This audit evaluated the fee-for-service Medicaid dental programs for children within DCH, and studies show that declining utilization of dental services, especially preventative care, may lead to increasing negative health outcomes for children covered through Medicaid and ultimately higher health care costs. Federal law requires that state Medicaid programs provide all children, member under 21 years of age, with full dental benefits. Such benefits include restorative, preventative, and emergency treatments. We'll present the results of this audit in our September audit committee meeting. The second current.
David,
Yes, sir.
Maybe this is off the subject, but you mentioned reduced use of the dental program by children. Is there a reason for that? Why is the program being less used is my question.
So.
If I understood what you said it was reduced utilization.
Yes, sir. Yeah, compared to other states and compared to
other states.
Private sector, and I believe within DCA's it has gone down a bit. So DOA's recommendation is implement new data-driven analysis, which the management has resumed doing so, and will continue to monitor it on a quarterly basis to improve the utilization of fee-for-service dental program for children.
Thank you.
The second current state audit is hospital provider fee performance audit. This is a fairly new audit. This audit was requested by the House Appropriation Committee, and they requested a special examination of the hospital provider fee program within DCH. This review will determine the amount of provider fees collected, how providers' fees are used, determine the impact to the state if federal funding is reduced. In Georgia, hospitals and trauma centers are assessed a provider fee based on their net patient revenue. Hospitals are charged 1.45% of their net patient revenue, while trauma centers are charged 1.4%. The third current state audit is new option waiver, which is now, and comprehensive support waiver, comp programs performance audit. This audit is also a new, fairly new audit, and it was requested by the Senate Appropriation Committee, and they requested a special examination of now and comp programs within DCH. This review will determine the following: waiver expenditures and related accounting controls, participant service levels and service delivery, and lastly, provider oversight and monitoring processes. Now and comp waiver programs are eligible Georgians with intellectual and/or developmental disabilities. Now programs offer services and support to enable individuals to remain living on their own or in their family home and participate in the community. And comp program serves individuals with more intensive needs, primarily those with intellectual and developmental disabilities who require residential care. Oh, and yesterday, DOA has given us an engagement letter for the FY25 schedule of employer contribution subsequent to the measurement date of June 30th, 2024 of the plans, and as of and for the year ended June 30th, 2025. This is an annual financial audit to opine on the subsequent employer contribution, which are the basis for the proportionate ratio and share of each participating employers. This schedule will be used as part of the GASB 75 engagement to allocate the total OPEB liability among the participating employers. And this year, this is something new. DOA has asked the board chairman to also sign the engagement letter. And my understanding is Terry Conrad, comptroller, is working with Denisha Williams to get the engagement letter signed by the commissioner and as well as board chairman, and which will be new this year.
So David, if I might just expound just a little bit here. So this is more of a formality, as it's titled as an audit, but really what it is the ability of our department with the Department of Audits to provide to each school system their pension liability for their retirees who are on the state health benefit plan. Because the liability for paying for the state health benefit plan employer share of the benefit falls to the school system if it was their employee that retired from that system. So each year we have to provide this amount for each school system that participates in SHBP for their retirees, so they can publish this as part of their financial statements and book this liability into their books, which is separate and apart from the liability that the department and the state would carry forward for state employees who are on a state retirement system plan. So it's very important that we get that out and we have it done timely. And I think we've escalated to have the board chair and commissioner sign for that awareness because of the amounts of the liability and the issue itself, to make sure that everyone has the awareness of where the liability for retirees falls and what the amounts are, since they are significant to each individual school program. Thank you, Ted.
Okay. Thanks, Joe.
And next, we have 3 completed state audits. First completed state audit is GASB 75, employer schedules for state and school OPEB. This is our GASB 75 engagement. GASB 75 engagements are to allocate the total OPEB liability to participating employers based on their proportional share of each employer for their financial reporting purpose. And the audit was for the year ending June 30th of 2024. These audits were clean audits, meaning no issues were identified. and the schedules were presented fairly in all material respect in accordance with generally accepted accounting principle, which stands for GAAP. And the second completed state audit is the personal care home program performance audit, which Lisa Davis will highlight today. The third complete state audit is the FY 2024 Georgia Annual Comprehensive Financial Audit, which is ACFR and single audit. It covered the period of July 1st of 2023 through June 30th of 2024. Annually, DOA audits the federal Medicaid program, and last year they also audited CHIP program as well too. This report is required to comply with federal regulations and provisions. And we'll also review these findings with the audit committee at our next scheduled audit committee meeting, which is scheduled in September of 2025. Are there any questions on current or active or completed audits? Yeah. If not, then I'll hand it over to Lisa Davis, who will present the results of personal care home program performance audit.
All right, thank you, David. Chairman Cruz, the purpose of this audit was to evaluate HFRD's efficiency and effectiveness related to conducting routine inspections, addressing complaints, and ensuring violations are corrected within state licensed residential facilities, which include assisted living communities, personal care homes, and community living arrangements. There were 6 findings. Prior to going into the details of the audit, I did want to provide a little bit of background. We talked about it included personal care homes, assisted living centers, and community living arrangements, but there is a total of over 2,800 facilities. So I want to make sure I put that into context, caring for more than 48,000 vulnerable residents. So while the complexity of these residents have increased over the last few years, I want to make sure it remains clear that the level of care remains lower than that at a skilled nursing facility, and skilled care is not provided in these facility types. The personal care home program is state funded. No federal funding for oversight activities is received. And all of this work in the 2,800 facilities is conducted by only 25 surveyors. As a relative comparison, we have 77 surveyors for our nursing home community, which has only 365 facilities. All state programs, survey, and enforcement activities are directed by state statute, in addition to the individual rules for each program and general enforcement rules. A state program matrix grid is used to determine severity of the citation and is based both on the impact of the resident and how many times it's been cited. So just want to make sure I really highlight that as we look at the level of citations, when we find something is not compliant, there is a grid and enforcement rules that tell us exactly how we hold the facilities accountable.
Is that 25 surveyors, is that considered a full complement of what's authorized for that position, or are we?
That is fully budgeted.
Joe, recruiting more people?
No, as Lisa indicated, that's fully budgeted. I think it's a matter of discussion, what should be the level that should be there, but that is what we are allocated and budgeted to accomplish the task. But given the audit and certainly the findings that they have, there is some discussion about whether we should have more surveyors in the future. Sorry.
And just to share, relative to that question, during periods of this audit, because this audit did cover the beginning of those pandemic years, there were some periods where maybe had 2 open positions, 3 max, but we are currently fully staffed within our program. And other than maybe 1 turnover in the period of time it takes to fill that position, we have been fully staffed at that 25 since I arrived in 2022. And so just the last point, unlike federal programs, state programs do not have survey frequency requirements in statute or within the rules. This applies to both the complaint survey timelines and the full survey frequencies. So just want to go through audit finding 1. The first recommendation was to the General Assembly, so we did not have a response, but they had recommended to the General Assembly to codify a required frequency for HFRD to perform routine inspections of residential facilities. We do understand that with this, there would probably require a fiscal note because we can't independently meet a requirement without adequate staff to do so. So under finding 1.2, we did agree, perform routine inspections in accordance with internal frequency goal. Again, there's not a rule or a statute. It is a goal created by our department. We would like to meet that goal, and that's why we agreed, but we do, of course, have limitations in our resources. Finding 1.3, on the new online portal, incorporate a place for facilities to document their accreditation status and provide copies of inspection reports performed by accrediting bodies. We have now implemented Gales, which is a new survey computer system. Once we implemented that, we did the finding recommended prior to the finish of this audit. I will say that we do not get reports from accrediting bodies directly from those accrediting bodies. That's pretty standard in that accreditation process. But what we do get is notification of the survey completion, and we can get those reports from the facility. But all facilities that are accredited are marked in our Gales system at this point in time. Audit finding 2, inconsistently followed its standard for how severe allegations are categorized and when they are investigated. Under finding 2.1, this is one of the few ones that we absolutely disagreed with because their recommendation was to have written procedures that identify allegations that maybe be border between categorized priorities of immediate jeopardy and immediate jeopardy high. By pure definition, there is always going to be gray complaints when we receive a complaint of whether it's an IJ or an IJ high. And that is why we have a team that reviews them, meets, make those decisions, and to try to put into writing how we make those decisions when each facility is unique and each resident case is unique. We have clearly established guidelines for IJ and non-IJ high, but when we have something that we are unsure of because of the details, it requires experts to make that decision of where it goes. Finding 2.2, require intake and triage staff to document all factors that contributed to determining how an allegation was ultimately prioritized. We partially agreed because we were already doing some documentation, but we did agree that we probably could write a few more notes so that after the fact, if a supervisor was looking at it, we could understand those decisions. And we have already taken steps to educate our teams on that. Finding 2.3, take steps to ensure that IJ and non-IJ allegations are investigated with prior timeframes. While we would like to do that, again, our resources are limited and we have to prioritize based on what we feel is most important. We are pretty close to meeting all of the IJ timelines. It's the non-IJ high, which are a category below, where sometimes we're not meeting that time frame because we have to prioritize mixing in the certification surveys and making sure we get out on the IJ's time. Finding 2.4, senior management should perform regular reviews of overall complaint categorization and investigation timeframes to ensure consistent adherence to internal standards. Again, we partially agree because while we can look at whether or not we met investigation timeframes, we know we're not going to meet all of them with our current resources.
Lisa, before you leave that, could we just define IJ?
Yes, I'm sorry. Under immediate jeopardy and IJ stands for immediate jeopardy. And so it is what you consider there is immediate threat to life and safety when you say it's immediate jeopardy. So somebody's life is immediately threatened by the actions that are occurring within a facility. Non-IJ high are those that are considered there might be harm occurring, but it is not an immediate threat to life and safety. Any additional questions related to that? Thank you.
So if we have an IJ that means that there's immediate danger or whatever, what happens from there?
So we get out to the facility within 3 days.
We what?
Our team will go out to the facility within 3 days and identify if it truly is. Because again, a complaint is that somebody's alleging that there is immediate jeopardy.
I see.
And then we would go out and we would investigate. If there is truly an immediate jeopardy, we are on site until they fix whatever is creating that
You say
immediate
we
jeopardy.
would go out, that's the 25 people?
That's one of the 25 people, yes.
Okay.
And they cover the whole state.
Yeah.
And also just to point out that this is not a 911 call. We're not first responders. This is an after the fact investigation, something that has already occurred that we're investigating. If there's an, immediate threat of that nature at the facility, they call 911, they call the police, there are other recourses. This is just regulatory.
What what would be the magnitude of those kinds of situations? Jay, would you have 100 of those ongoing, or would you have 5 or 10 or?
I'd have to look at the data. It kind of fluctuates because some of those are also self-reported immediate jeopardy instances, like elopements, right? And so I would say because we clear them in 3 days, we don't generally have open IJs. We maybe have one, maybe sometimes 2 in a week, and then we might go a week without one. But they consistently come in. But again, some of them are also self-reports where they might report that you know, an elopement or
Which,
Yeah.
an elopement?
oh, yes, I'm sorry. An elopement is where a resident unintentionally leaves a facility. And I'm sure there is a better definition of it, but to summarize, there's technical definitions. But when a resident should not be leaving a space, they leave that space. Some facilities do have courtyards, so going outside is not necessarily a definition, but going outside of the controlled space of a facility unintentionally. Unintentionally by the facility and family. Sometimes it's intentional by the resident, but not allowed.
Thank you. So particularly for memory care,
Yeah,
where they could harm themselves and they go into the street or what have you at odd times in the night. So an IJ, for example, might be that the fire alarm door that's supposed to trigger staff to let them know someone has exited the building at an inconvenient time is not working. Or maybe the lock is not working that allows them to leave unintentionally. And that would be, in some instances, an immediate jeopardy that we needed to assure that they fixed that deficiency in the facility so that others wouldn't be able to elope, just as an example.
And another example would be allegations of abuse, right? So if we get a report that somebody is alleging that somebody's hitting the residents, sexually abusing the residents, that would be another instance of an immediate jeopardy.
thank you.
And it's the time frame is 3 days, is that correct? Within 3 days?
Again, that's a goal timeframe
That's a
because
goal.
it's not statutory or ordinance.
Okay.
And the contrast being on the federal side where we get federal funding, it's a mandate. So for nursing homes, there are mandatory response times, and that's why you have almost 80 surveyors for 367 facilities versus the over 2,000 facilities and 25 staff. The standards are very different on the state licensure side versus federal. The federal regulations are thousands of pages long. The state requirements, you know, it's what, maybe 60 pages. So very, very different standards and different resources.
And with finding 2.1, what's the process when you disagree with the finding from the audit? And how is that documented?
I'm sorry, say that one more
What's
time.
the process when you disagree with the finding from the audit and how is that documented?
So if I may, Lisa.
Go ahead.
So on performance audits, what is happening is the auditor has made this statement, but then we're disagreeing and we're providing factual knowledge for that. And then they can take that knowledge and they'll put it, typically what happens in my experience is they'll put your disagreement and your explanation underneath their finding. And they may not agree with your position, but they will state it in the audit. And the audit is published to the legislature. Primarily, that's the audience that is receiving this. It's also available on the website for the public, but generally it's just our response and a fair and factual response that's out there and how we will proceed on that. And then it's generally left at that. And then at some point in the future, we may have a follow-up by the auditors and then to ask, and then in the past, if we disagreed strongly as we do here, unless some factual part has changed, we would continue to disagree and state our case again. And since it's just a performance audit, just awareness really for the public and for the legislature, there's really no outcome to that per se.
Some of the statements that were made were, we do this within our resources.
Right.
We're in the process, Joe, I think, of finalizing a upcoming budget. I assume that the department is inputting into that budget request for resources that are needed.
Well,
Is that true?
Well, it's not true at this point in time because the governor has instructed and then came out strongly after that and instructed agencies that we are in what is known as a flat budget.
Oh,
So we don't have any opportunity to request resources formally of the governor or the legislature this year.
okay.
So, and that's why this is important from the audit and legislative perspective, because this is directly back to the legislators. And if we give them opportunity, if they say fit to change the law and potentially start the process for resources. I do want to remind everyone the importance of what Lisa said in the very beginning, that these are not a skilled level of care under the definition. And that means that there's no nursing services. And the reason for that is there's not intended to be residents in these facilities who require that level of care. These are generally, when this was established, thought to be people who just needed additional care for life skills, but were not in a position where they needed constant care and oversight. Now, that has changed. And there are certainly levels of care within these facilities who, for whatever reason, either through affordability or family wishes or their own wishes, were not going to a nursing home and are staying in these facilities. And that, creates challenges that are there. But there was never the intention, and we're not funded because of that, to drive some of these recommendations that have really morphed as this population has changed. And that's really what the performance audit brings out to some extent. But that's the reasoning why we're set up. I mean, originally it was set up that, well, they may need some assistance bathing. They may need some assistance eating and feeding and clothing, in the morning because of whatever case. But they're supposed to be mobile and largely supposed to be physically and emotionally themselves and independent in that respect. That's not necessarily the case today as we've expanded the utility of these, but that's the paradigm that we're in, as opposed to nursing care, which is obviously could go all the way to an immobile person in a hospital bed that has 24/7 nursing care, so a totally different standard and level of care that is in a nursing home facility. So I think people forget that and they mix these all the time when we deal with them at the legislature and with the public, and they are clearly and distinctly different levels of care.
Joe, thank you. That's a great clarification.
Thank you.
Well, and related to that, our rules have also changed over time to compensate for some of this increased level of care, but the budget and positions have not over those times that we've had more rules. And so it does take us longer when we're in the facilities, because when you have more rules, there's more investigation. In addition, over the period of the audit, there was over a 40% increase in the number of complaints that come into our department related to these facility types. And it's because as you see more complex patients, maybe not always in the right level of care, those complaints are going to increase. So when you think about the increase in the workload over the period of time.
And important to mention too, that this audit covered a portion of the COVID pandemic. So our ability to survey was extremely limited at the beginning, right? Especially in some of these facilities may only have, 5 to 10 residents. So if you have an outbreak in a, personal care home of that size, difficult for us to go in and survey. We actually did some virtual surveys during that time to try and keep our staff safe as well as the residents of the facility. So that COVID period of the audit, I think, is maybe not reflective of what the data would be for normal operations period.
Under audit finding 3, inconsistently sanctioned non-compliant facilities are verified return to compliance. So under 3.1, 3.2, and 3.3, we have a similar response. I'm going to go through those and kind of just provide those in a group. So the 3.1 was ensure the facilities found to have violated state requirements are appropriately fined in accordance with state law, rules, regulations, and established internal procedures. Document penalizing actions taken against specific violations and establish timeframes for notifying facilities of payment obligations when fines are assessed and a facility's fatal pay. So we were actually working on a standard operating procedure guide related to these enforcement and follow-ups. Again, related to our resource limitations, we don't always do follow-up visits to ensure compliance, because ensuring compliance is not a priority over immediate jeopardy situations, right? So we have cited them, we tell them what they have to do, they send us the plan of correction. Verifying that plan of correction in priority wise would fall underneath new complaints coming in where we don't have that insurance that things are happening. But we did create an enforcement SOP as well as demand letter SOP to take care of all three of these even before the performance audit was completed. And it guides us to have a weekly meeting with leadership and the program where they present any facilities that have citations that are above a D level, meaning there are care-related issues or pattern-related issues. And so therefore we would make sure that we agree on the level of citation, we agree on the penalizing action for the violation, as well as then we have a demand letter process that outlines at 30, 60, 90 days, how we notify them of the fine, how we notify them if they fail to pay the fine, and what actions occur if they continue to not pay that fine. So a very defined process now in place. Finding 3.4 said with its new data system, ensure the facilities submit plans of correction within 10 days and consider subsequent sanctioning actions for facilities that do not comply. While our new data system does allow us to submit the POCs, it is actually difficult because we cannot regulate the technical capabilities of the facilities. We don't have rules that say a facility must have a computer, that they must be able to submit a POC via computer. We are trying to do education. We are trying to get everybody up to date, but it is something that we cannot enforce, and we cannot provide a sanction for not submitting a digital plan of correction. Everybody is supposed to submit a plan of correction. Sometimes it's via fax. We've seen some written on a piece of paper, mailed in. The point is to get a plan of correction. So we don't want to start sanctioning facilities if they are making significant efforts to submit a plan of correction, whatever that path. Establish clear criteria and relevant documentation related to suspending or revoking facilities licensing. Again, kind of going back to the border criteria, right? So it is not our goal to suspend or revoke the facility because people live there. And if we suspend or revoke a license, that means everybody that lives there must leave that location. So that is not something that we do lightly. Should we get to the point where something is not being corrected, we have significant concerns, and we feel like those residents' lives are at greater risk by staying there than by leaving, we would talk to general counsel. So there is a defined process in how we do it. It's hard to put it in documentation because we don't always know, the situations are always going to be different. For an example, bed bugs. Nobody wants to talk about bed bugs, right? Generally, facilities can't get bed bugs because sometimes they come into these facilities from a not clean home environment. We want to give those facilities opportunities to fix that problem. That problem does not fix quickly. Sometimes it's over time. And so generally, we are not suspending a license when you have bed bugs. Not long ago, we had an instance where we've been in 3 different times. They were getting worse, not better. It was dramatically impacting the life and safety of the residents. And we did speak with general counsel and we did suspend that license so that they could move them out, fix the problem. And if they so choose to, prove to us it was corrected, they can move them back in. So again, you can have the same problem with different mitigated circumstances. So you really can't put that into writing. So again, we have a meeting where we discuss, we decide, we review with general counsel. So there is a process, but not criteria. And that is why we partially agree.
And just again, a reminder, you got everything from like a 4 or 5 bedroom home where there's minimal staff, that's a personal care home, all the way up to a facility that is maybe 100 or 200 multi-level apartment style, independent type for assisted living. You can just see that's going to be a very different approach to those complaints on those types of facilities and the resources that are available.
Under audit finding 4, websites maintained by HFRD and facilities do not enable the public to easily identify violations and compare them across facilities. So finding 4.1 said ensure facilities comply with the requirement to post violations on their websites. We did agree. We have added that question to our entrance survey when we do a recertificate or relicensure survey. And so we agreed and we have addressed, and it is being taken care of. Finding 4.2, consider penalizing facilities that fail to post inspection reports and plans of corrections. This would be a paper citation where there's no actual resident harm. So while we would cite them, we wouldn't penalize with any kind of level And again, our enforcement matrix tells us what those enforcement actions would be. So we partially agree. Finding 4.3, we did not respond on that because again, it was a recommendation to the General Assembly requiring HFRD to publish on its website aggregated data. That would take a lot of work. That would probably take contracts and that would take funds. Currently, we do have on our website Map to Care where you can look at facilities, you can see their survey findings. It's just not an aggregate comparing one facility to the other. Audit findings 5. HFRD and DBHDD shared oversight of community living arrangements could be improved with increased coordination. We absolutely agreed. Moving forward, CLAs is actually moving over to under the full authority of DBHDD as of January 1. But in the interim, we began meetings to make sure we are collaborating as we not only work to make sure we're all on the same page, but moving it over. And anytime we go out to a CLA, we are now emailing them if there's enforcement action so they are fully aware. Audit finding 6, lacks written formalized policies and procedures for certain core operations. On finding 6.1, we did disagree because it talked about development and implementation of formal policies and procedures specific to state operations, including survey processes and staff training. We have very formalized rules and there are statutes and that governs our work. And so we felt like we don't need to repeat what is in rules and policy. Now on finding 6.2, we did agree that we could create more standard operating procedures versus policies where we could outline the work that we do, best practices in doing that work. And we had already started that process as we talked about the enforcement SOP. That was already started before any of the audit findings came into play. So we do agree. And then every year as we look at our strategic plans, where we're going and what gaps we have, we will continue to look at what other procedures that we could write up. But that's an ongoing process, not something that overnight we could decide to write procedures for everything that we do. And that is the end of the findings. Any questions?
Yes. Are there any questions? Okay. Lastly, I'd like to mention that the leadership of DCH takes every audit as an opportunity to improve and is committed to making the changes necessary to come into compliance. The tone at the top is very strong, and as always, thank you for the opportunity to share this update with you all. And please let us know if there are any questions. And Chairman Cruz, I'll hand it back to you.
Thank you, David, and thank you, Lisa, for that very thorough report, and Joe for your help in helping all of us understand the depth of these findings and the responses. We appreciate what the department's doing and certainly understand that the General Assembly has to act to help address some of these findings if they choose to do so. With that, are there any other questions or comments from board members before we adjourn the meeting?
No questions from me.
Okay. All right, if not, then we'll adjourn our meeting, and of course, we're scheduled to meet again, as mentioned, on September the 11th, to be able to continue hearing updates on the completed audits and specifically the FY24 annual comprehensive financial report and single audit from DOAA. Okay. All right. Thank you very much. If there's nothing else, then we will stand adjourned.